Welcome to the Insight podcast. Joining me on the show today is Dr. Kiran Agarwal. Kiran has worked in medicine for over 22 years and specialises in ENT, that's ear, nose and throat, health. She also works with entrepreneurs and high performers to help them stay well, avoid burnout and maximise their happiness. I talked to Kiran about the prevalence of respiratory disorders, what the main causes of these health issues are, from air pollution to food, and of course, solutions. What approaches help, including diet, which foods to eat more of and less of, how easy switches to our cleaning products and routine can help, the way we breathe, how simple practices can reduce symptoms and even get people off medication, as well as the difference that nasal breathing, i.e. breathing through the nose, can make, and much more. Now, as always, before we start, I do have a quick favour to ask. If you haven't already, please hit the follow button wherever you're tuning into this episode. And if you've been listening to the show for a while, I'd really appreciate it if you rated the show too. This will help more listeners discover the podcast and the insights from all of my amazing guests. Right, now for my conversation with Dr. Kiran Agarwal. Enjoy. Right, Kiran, second time on the podcast, but a different topic this time because we've kept in touch since then, which has been fantastic. And we've kind of chatted a little bit about your other area of interest, which is respiratory orders, diseases, issues. And that's something that I'm particularly interested in. You know, I suffered with asthma since I was a child. Still have kind of flare-ups when I do feel under the weather. I can really feel it on my chest. And actually, even in the last couple of days, picked up something and it feels like it's sitting there. And I walk up a flight of stairs and I'm out of breath, which is something that really damages my ego because I'm supposed to be a fit, healthy human. So I've got that particular interest. But I think also more widely speaking, lots of people are interested in this topic, aren't they? And maybe particularly at this time of year as well, when lots of people are coming down with these bugs and flus and things. So why don't we start with what's the current kind of state of play in terms of some of these things that people are suffering with, experiencing at this time of year, and maybe even more broadly speaking as well?
Yeah, sure. Well, thank you for welcoming me back again. And it's great to stay in touch with you. I think we're almost becoming friends.
Yes.
With area health, and as you said, at this time of the year, we have all these viruses and bacteria which are causing lots of infections. In the last couple of weeks, you probably may have noticed more about winter crisis and NHS under pressure. Ambulances again queuing up with all the extra load on them from all these problems from asthma or similar respiratory problems. My interest comes from my ENT background. So I'm a GP as well as an ENT specialist, and I see lots of these acute infections and chronic problems. And yeah, so basically at the moment, I think according to the data, 1 in 5 of us have a respiratory disease in UK, so that's a lot of people. And 1 in 3 deaths in UK are caused by respiratory problems. So it is a significant burden for the society in all terms of disease, the economy, as well as in terms of putting other diseases under pressure, because that takes a precedent. Because if somebody is not able to breathe, that is prioritized on top of cancers and other pathways. So we're talking about the dominoes effect this has on the whole society, the nation, as well as we get ill. Like today, somebody in the clinic is ill, and that's why I'm in this gear, because I have to rush off the clinic, which wasn't planned. So it's pressure all around from this.
Yeah. And I didn't realise the numbers were quite that high. So aside from asthma as well, what other disorders, diseases are we talking about? Emphysema, I know, a couple of people, elderly people in my family suffered with emphysema. What else comes under the umbrella of respiratory issues?
Yeah, so if we divide it into like infections and then the chronic lung conditions and then the cancers, as well as chronic nose problems like chronic rhinitis and sinusitis. So acute infections, pneumonias, or sometimes even worse, like empymas, but more general, like just cough and cold. And a cough and cold in elderly would be different to cough and cold in you and me, so-called healthy, fit people, or in a child who is premature and has got underlying vulnerabilities because of their prematurity or other problems. So sometimes a simple thing and a complex kind of underlying health problems can become more of a challenge. And in the disease itself, lung cancer is on the rise, asthma is on the rise, emphysema, as you said, or chronic obstructive pulmonary disease, and with COVID and long COVID and interstitial lung disease or pulmonary fibrosis, which is a sequel of COVID, or other long-term chronic conditions, or sometimes occupational health hazards when people working in certain types of factories and industries and they pick up some of the particles which are harmful for their lungs. So, or in previous world, asbestos related lung diseases, and we are seeing those as well. Luckily, asbestos is something which we don't see that much of in new patients. So it's quite a variety, if you see, and it's much more common than we think.
Yeah, and you mentioned long COVID. And I think that's interesting, and I don't know if there's people out there, people listening, that might be thinking, "Have I got long COVID? Could it be that?" It seems like people are maybe kind of suspect that they might have long COVID, because when you have that kind of that shortness of breath and tight chest, and it's like you're just not shaking something off. I don't know about you, but I hear about this all the time from colleagues, friends, families. Like they've just got this thing that won't budge after 4 weeks, 6 weeks. Is it likely that that's long COVID? Are we underdiagnosing or overdiagnosing long COVID? I know that's not the complete subject of this podcast, but just briefly, I don't know, intuitively, what's your kind of sense of long COVID at the moment?
Well, it is something which we are learning because it's a new disease, and we are seeing it's affecting people, like more and more amount of COVID infection somebody's having, then they are having more and more of these chronic or long-term conditions resulting from it. And long COVID is not just affecting the lungs, it's affecting the heart, it's affecting the other parts of the body as well. In terms of the lungs, if you're focusing on respiratory and COVID, and this is true for any respiratory condition, if somebody's feeling unwell and they're feeling that their capacity has changed or they're having symptoms, then depending upon how bad it is, they need medical assessment fast or routine. So it's hard for me to kind of put them in a bracket because I don't want any misleading messages like this is fine and this is not fine. And as a doctor, that's what we normally say. If you're concerned, then raise it with your local medical services, and then we can guide you more appropriately. In terms of more specifics about what the condition can do, it can make the lungs stiffer. And that's what is fibrosis or interstitial lung disease. And we do need to do proper diagnostics to make sure that's what they have got, or there's something else which is causing it. But we are, as the disease is evolving, and we are seeing more and more, and hence the benefit of doing the COVID test, because sometimes, because it's not in the guidelines anymore, we think, oh, okay, well, it's just a cold, but I find it's useful to know what we have got, whether it is this or not, because sometimes when things are not going as expected, then we can refer to that information that, oh, okay, well, this is the reason why it's not working like that, because then that opportunity to get that information is lost if we haven't done the test in the earlier part of the illness. I don't know if that's making any sense or not.
No, it does. And what I'm thinking as you were explaining then is I wonder how many people have kind of adjusted to their new normal of kind of feeling this way and just thinking, well, this is how it is. Like I'm a bit more short of breath and I'm a little bit more lethargic and I'm just used to it. This is it. And I think it's nice to hear that reminder sometimes. Actually, no, if you've noticed a change in yourself, get to your GP, get to the doctor, and actually get a professional opinion of what's going on. It feels like it's similar to, I don't know, stress or your sleep quality reducing, that it can kind of happen gradually, can't it? And then you adjust to that new normal and like, yeah, this is how stressed I am now. My baseline has changed and that's okay. And it's like, no, hold on, actually, because maybe you're not as vibrant and energetic and engaging with life in the way that you potentially could. So if you notice a change, go and see someone, get it sorted.
Yes, exactly. And especially true for blokes, because I can't tell you how many of you are being forced by your partners or your wives or your family to come and see us because you thought it was fine. And they're like, no, I've been told to come and see you. They can't even tell me why they've come to see me. They're just like, oh, this appointment has been booked by my family to come and see you. Okay, tell me, what have you got? So yeah, please, if you're feeling like that, please take action.
Yeah. I don't know if there's some data about lifespan with married men, maybe that they get looked after so much better with the wives prompting them to go and get these things checked out and not just pushing through.
Yeah, married or living with someone.
Of course. Yes, of course. Yeah. In whatever situation you have in 2024 going into 25, we are open to them all on this podcast.
Yeah.
Right. What about causes? So I mean, how much do we know about the causes? Is this on the rise? Is it on the decline? I hear more about air pollution, the pollutants, plastics, microplastics. Are these things affecting? I hear about diet. And I know we're kind of doing a whistle-stop tour here, aren't we? And kind of hitting as many topics as we can. But as much as you can expand on that, causes, I think it's really interesting to know.
So in terms of causes, and unfortunately, it is on the rise. All these respiratory diseases, like most of the other chronic illnesses, are on the rise. And there are lots of contributing factors to it. And most of it boils down to how we're living. Because most of these are lifestyle-oriented or lifestyle-related illnesses. And some of it is in our control and some of it is not in our control. If you look at the very core, the Western living, very urbanized societies and health inequalities, and those are the more common factors why there is this rise in respiratory conditions. So what do I mean by that? So people who are living in more deprived areas, they have less access to healthier education or healthier living, and the housing or smoking, because they're more prone to having these habits, and in the smaller kind of houses, if there's indoor smoking or even vaping, and that sort of things, the pollution, which is external as well as internal, it's not knowing what is affecting your health. That health literacy as well is a very important thing. And you mentioned about diet, and diet is another thing which may not be a big factor, but it's an important, significant thing which we have in our control sometimes to say, and I call it better eating for better breathing, and that's a scientific paper that goes by that name. So lots of things we are discussing is like there's something which has to be done at the government level, community level, and there's certain things which we can do at individual levels as well. And that is to focus on what's happening in our local communities and in our own homes, and how we can reduce the impact of all this on our own health. And it's just one of the other pictures of how we're living and how it's affecting our health.
Some of the stats around air pollution and you being closer to a road or to a city centre, how the rates of asthma go up. It's incredible. And is mold a problem as well? I don't know. I mean, I find I live in an apartment on kind of the second floor, and I'm finding that more now when you kind of you've got the heating on, but then you've got a very damp outside. It feels like I'm spotting these areas of mold that I'm having to keep on top of a bit more readily over in these months.
Yeah, no, you're doing the right thing by staying on top of it. And along with other factors, it is something which can affect the airways because we are breathing the toxins from the mold, and that can make the sensitive airways, especially if you have had previous asthma, that can make the airways a little bit more reactive and inflamed.
Right.
So it's usually an indicator of humidity levels being high. If there's mold, that means it's damp. And the dampness, apart from the mold itself, high humidity levels are usually not the right amount for the air we are breathing in. So that's one of the other things which we have to look into, but in the context of everything. And yes, like if you said like which one is more harmful, smoking or mold, obviously smoking is much more harmful than mold. But yes, if you're looking at everything, then that also counts. I have got patients who have had mold in their housing and their asthma got worse. And once they were transferred, we had to use less of the drugs. So it's definitely a factor amongst everything else.
Yeah. So you mentioned some of the solutions that we can put in place, but how some of them are out of our control. Perhaps our living situation, living in a westernized, industrial country, we might not be able to do something about that, certainly not in the short term. But there are some things that at an individual level we can do, and we can make some small, not necessarily very drastic changes that could help, couldn't they? Are there any in particular that you'd like to bring up and point people towards?
Thank you for asking. And there's something which we can always do about our own health, isn't it? I mean, the most important thing is the smoking. So if anybody is smoking, and it's hard to give up smoking, I always say to my patients, like, look, it is not an easy thing if it's a habit which has been there with you for 10, 20, 30, 40 years, but it's actually a habit which you need to address, and we can support you. So please don't feel like you have to do it alone. Most of the people I know, they do want to give up smoking, but they're just either not ready or they're ready and don't know how to. There's a lot of support available. So that's the first thing I would like to just mention.
And sorry, just stop you there. What is particularly effective? I'm kind of a bit detached from this, I guess, but are there any strategies that are actually proving through the NHS to be successful in terms of getting people to quit smoking?
Yeah, so it's a combination of medical and psychological interventions, right, and the support, because it's a habit which we had. Imagine just a small habit if you have to change, just like if you have to drink more water, how hard it can be. And that's adding a habit. And now we're talking about subtracting a habit, which is addictive. That is a massive challenge. So we have to understand that just saying somebody stop smoking isn't enough. We have to support them. So depending upon the personal situation, sometimes people are very motivated. It just reminds me of a story of a 69-year-old lady who had become a grandma about 6 months ago, and she has been smoking for like 40 years, and she had emphysema, chronic obstructive pulmonary disease. And every review, they get annual reviews, and every review she's been advised to stop smoking, and she's like, oh yeah. And then suddenly she comes one day and says, doctor, I want to stop smoking. I'm like, oh, wow, what's happened here? And her reason for that was she now has something to look forward to, and that's a grandchild. And she wants to play with the grandchild without getting breathless. And she realized that smoking is the number one thing which she can do to help herself to be able to enjoy those moments with her grandchild. And she was so motivated, within 2 months, she gave up smoking. So the motivation, the reason why somebody wants to stop, that's what we have to look into. And then once somebody has decided, having adequate support, whether it is through whatever nicotine replacement or tablets we give them, and psychological support. Now, one thing doesn't work for everybody, so that's why it has to be customized. And most of the areas have NHS funded services. So they just have to look up NHS Stop Smoking and something will come up in their local areas. And most of these are self-referral. They don't even have to go and see someone.
Oh, okay. That's great. Sorry, I threw you a bit of a curveball there, but I just thought it was interesting to pick up on it. So that's great.
No, that's okay. This is my job. This is what I do. And in terms of other things, there are lots of little things. But the way I start in my clinics is explain how the things work. Because lots of people come with symptoms like I'm coughing, I'm producing mucus, I can't breathe, and those type of things. And then just going through a little bit of how the system works helps them to see why these strategies or why these habits are important. And believe it or not, people pay more attention once they understand why we are doing something rather than just doing it. So with my bad diagrams, I've still not picked up good, pictures, drawing or anything. I tried to explain. So this is the lining. So the first thing I say, look, this is not just tubes. We're not just breathing air through it and it's just coming out. These are living and breathing kind of parts of your body and they're active. So we have to understand when we're breathing through the nose, what's happening in the nose and then what's happening in the lungs. So essentially, say we're breathing air which has got, say, dust or virus particles or something else like pollen or mold or whatever. It's at different temperatures, it's at different humidity levels, but lungs need that air at a certain purified, clean and filtered and humidified at a certain level. So all this work is done by the upper airways or through the nose. So the nose produces about, now believe it or not, 1 liter of mucus every day.
Wow.
And that's the reaction I get from every person I tell them this, that's the amount of snot we produce every day without noticing. And the purpose of that is to trap any organisms or particles, because that's how it gets trapped. And to filter the air, to humidify, to bring it to a certain temperature. So it has to keep on kind of replacing itself. And the way by which it does is through this little kind of cilia, we call it, on top of the cells which line the nose, and they keep moving in the direction of the throat. So we keep producing more and more mucus by the glands, and it does its jobs, and it's like a conveyor belt, and we swallow it, and we don't notice it. Yeah, so that's the normal way the nose functions. And that's why nose breathing is important, because then nose does the job it has to do, and then the air which reaches the lung is ready for it. And the lungs are happier, or shall we say, doesn't get inflamed or doesn't get sensitive because it's getting the right air. There are other functions on the nose like nitric oxide and other things, but that's the basics. And we breathe about 10,000 to 15,000 liters of air every day. So it's a huge volumes we are talking about here. So once we understand like how hard our system is working to keep us breathing and what are the functions which are happening, then we have to ready to support it and understand the pathology when things change, when there's infection. So when there's infection, when there's inflammation, how does the body respond to that? So when somebody has got asthma or when somebody has got chronic lung disease, what's happening to that airway? It's chronically inflamed, or it's in a chronic process of reactions. So the reaction is to produce more mucus. And that's why more coughing, because we are having a system which is not normal. And the normal response to any inflammation is to produce that extra thing to get rid of whatever it's trying to get rid of. Am I making any sense?
Yeah, absolutely. Yeah.
So the question is, how do we reduce the mucus to get to the normal amount? And this is where we have to look into a few different things. So one, we have spoken about better eating for better breathing. And that's usually, I put it into an umbrella of things like less processed food, like everything else, like less processed foods, more plants, and more water. All those things are helpful for airways as well. You eat more sugar, you eat more processed food, you have more of the animal-based foods, your airways are going to get inflamed like any other organ. That's one part of it. The other part of it is what's in the air, because if there is a lot of inflammatory products, substances in the air, so nowadays there is this thing about using air fresheners, lots of cosmetics we use, perfumes, also cleaning products. Cleaning products can be harmful to the airways, because the traditional cleaning products we use, I don't know whether you're aware, they have something called, when they release into the atmosphere, they produce something called VOCs, or volatile organic compounds. So those volatile organic compounds are quite irritant for the airways, and it can produce more mucus. It can inflame them. So just these little things, like, okay, more water. I'm not saying be less clean. I'm just saying use different cleaning products. So there's something called green cleaning.
Right. Yeah. That was going to be my next question. What are some of the swaps that we can do in our house to do that?
Yeah. So there's a very good advice from World Health Organization on if somebody has got dust allergy and how they should clean their home and stuff like that. So I use that same principle for everything else, because if it works for somebody with dust, then it should work for every other human being. And that is to have, depending on where we live. So, if I'm talking to somebody who's in India, they have to clean their home twice a day, compared to somebody who's in UK, at least twice a week at least. So keep the inner kind of surroundings clean, and then clean the beddings, and have less of the chlorinated chemicals and all the products. Have more kind of water-based or vinegar or simpler kind of cleaning products. If you regularly clean, then you have to use less of the harsh chemicals. That's the idea. And ventilation, keeping windows open when it's possible, so that sort of thing. So staying on top of cleaning, so that you are not needing to use too much or too harsh of these chemical things, which can again irritate the airways and cause more inflammation.
That's really interesting. And good to know about some of those little swaps. And also in the back of my head, I'm kind of feeling guilty for the amount I clean my apartment. And maybe I need to be a bit more regular, because I maybe do that, kind of delay and then do a deeper clean, kind of less often. And so that is an interesting point. But I am seeing more of these types of products, even in, I do my food shop at Aldi. And I feel like even in Aldi, there are these more eco, what else, and like kind of allergy friendly products as well, more natural ingredients and things. So it feels like people are wanting more of these types of products, aren't they? And they are available. You just might have to do a little bit of searching to find them.
Yeah, you're right. I haven't done shopping for some time, so I might have to go and look out what's available. But sometimes when people are looking for something nowadays, the manufacturers are very clever. They will give you that, but they may not be giving you that. So just be careful.
Okay. Yeah, good point. Dive a little deeper. Okay. Yeah. It's like those high protein, I don't know, yogurts or cereal or whatever. Yeah, great. But it's also full of sugar.
Yeah, exactly. Yeah.
Okay. Noted. So we've talked about a little bit about diet, how that can help. More plants, less processed foods. We've talked about things in the home. Is there anything else that can help people?
Yeah, and this is more kind of in line with people who have got asthma, because they also concomitantly have allergic rhinitis or symptoms of problems with the nose. And that is something seen in 80% of the patients with asthma. There's something called allergic rhinitis in asthma, ARIA. So treating the nose helps the asthma symptoms as well. So don't ignore that if you have got a little bit of snotty nose or sneezing a lot, that don't ignore it. If you treat it, the asthma also is known to improve. Obviously, treatment for asthma is important, but at the same time, you may need less of the asthma treatment if you have taken care of the nose. And simple thing which most people can do, and they don't need to see anyone, is to clean the nose with saline washes or saline sprays. And that can help in about 50% of the cases who have got milder symptoms more severe symptoms, we need to assess and see what's going on. But in the milder cases, as simple as the formula, we have to be exact, but it's salt and water, and just using that gentle wash. It doesn't have to be something too dramatic, because sometimes patients ask me, oh, I watched a video, the water has to go this way and that way. No, just take the water, if you don't have anything, in the palm of your hand and just sniff it up your nose and let it come out. And that simple thing is so effective to keep the lining inside the nose healthy and functioning, that it can also improve the symptoms of asthma.
That is such a good one. And sorry to interrupt you, Kiran,
no, that's okay.
but I feel like I need to be doing a bit more of that, because I'm breathing so much better nowadays and more clearly through my nose, because of something that I want to talk to you about in a second, because of the breath work I've done, and because I've done, more focus on nasal breathing, breath holds, and all these different things. But I still get a really irritated nose. If I go from doing a quick walk outside when it's cold and then I come back in, it feels like that can aggravate it. I feel like there are just times when I don't know what's caused it, maybe something in the air. I can be quite prone to allergies as well. If I go to my sister's, who's got a cat, bless her, she always tries to keep the cat out. She really tries to look after me, but sometimes little Bob sneaks in and then I can have a reaction. And I remember trying one of these products, like with a kind of a looped tube and the thing on the top, and like you squeeze it and it goes up your nose. And afterwards it felt great, but at the time it was horrible, to be honest. I didn't enjoy it at all, because it made me then just sneeze about 10 times in a row and really kind of uncomfortable. But your tip about just having it in your hand and maybe starting more kind of gently and experimenting with that was interesting.
Yeah, so the thing is that, again, we go back to what are we trying to achieve. Obviously, when we go to the shops, there's so many ways of doing the same thing. But is it more effective, or is it if it's more expensive or more, I don't know, strange looking pot, is it going to be more helpful? I don't know. But the basis is that we are irrigating the nose with low pressure and high volume. So it's a low pressure system which helps to clear all the inflammatory mucus. So the idea is that if we clean the mucus, then it helps the cells I was talking how they work. It helps the cell to function better. And then slowly, if we are keeping on top of it, being consistent, the function kind of is improved. And sometimes, it's near normal as well in some people. And if it's not, then we have ways of dealing with it. But as basic as with the palm of hand or more fancy products like bottles, it doesn't matter, but it has to be gentle. Mm. The whole point is having a low pressure system, which is cleaning the nose of the mucus, which is a bit inflamed. And that helps the function of the underlying epithelium.
Right. I might have been a bit aggressive, maybe. Maybe I just squeezed it too hard.
Well, you're not the only one.
Right.
I mean, this is a common thing which I see in clinics, and sometimes I just have to repeat. And I know sometimes I'm being pedantic with my patients, like, no, you have to do this way, and you have to do the spray this way, and you have to do that. And I feel it's because it's not a tablet. It's something which we have to do to get it right. If I don't explain it, if they leave my clinic and they have not been told how to do it, they're less likely to look it up themselves and then figure it out.
Yeah. What about then linked to that, the way we breathe? We just mentioned breath work and nasal breathing. If you've got any tips around that, how people can get started, because I think the difference people can notice in themselves when they do this, it can be profound, can't it? So any little tips would be great.
Absolutely. Thank you. Before I go on to the breathing, cats, because you mentioned about cats. Cats, by the way, are super spreaders of, so cat dander can be allergenic to some, but even if your neighbor has a cat, you can have allergy to it.
Wow.
Because the allergen, the protein, is a super spreader. It just spreads so fast. So your sister having cat is great, but you still have symptoms because you cannot get rid of it completely.
Yeah. Okay.
And in experience, lots of people have got cat allergies, but they love the cat more than their relatives.
Yeah, it's true. It's true.
Okay. In terms of breathing, so the main thing which I say, don't forget the nose. Breathe through your nose. The whole purpose of nose is to help breathe and have the air in the right temperature, clean and humidified for the lungs. Otherwise, the lungs become more sensitive and reactive. And there's some practices of breathing which are known to be helpful, and there's evidence-based, especially in asthma, that some beautiful breathing practices can actually help asthmatics and reduce their inhaler use. I would not recommend anybody to reduce the inhalers without having a medical review, but starting breathing practices and just focusing on breathing through the nose and learning how to slow your breathing and just focusing on your breath. It's a bit like exercises. Suddenly I'm reminded of a patient who was 85 and he developed a chronic lung disease, the emphysema, just a few years ago. And he'd come for review in my clinic. And he was so much better, I had to stop his inhalers. And I had recorded a video of him because he allowed me to record what he has been doing with his with himself. And sadly, I lost the video because I'm not so good with technology and I just didn't save it properly. But he's still in my books. I'm sure he can record it again. But basically, there were a couple of things he was doing. He has a dog and he walks the dog every day, right? So what he was doing, when he was walking the dog, he was focusing on his breathing. And he would take 1-2 steps, and that's the time when he's inhaling. Then the next 2 steps, he is holding the breath, and next 2 steps, he's exhaling. That was his little trick of getting his breathing patterns right. So he was using that time when he was walking the dog to do some breathing exercises, because he just learned that if it's lungs, it has to be breathing. If I learn how to breathe better, my lungs will get better. The second thing he did, and this is something which we don't talk about, not just the breathing exercises, it's the general exercises, so upper body exercises. Remember, the lungs are sitting in the chest, and the chest is muscles, the intercostal muscles, and all the muscles. If your muscles are strong, then then it can expand more, and the lungs will then be able to expand more. If your chest is not strong, then you can't do that. So he was doing some extra upper body exercise as well. So a combination of general exercises, upper body exercises, and breathing exercises. And I had to stop inhalers in him who is 85.
That's inspiring. I'm just imagining this jacked guy with this 85-year-old with a huge chest because he's on the bench press.
No, he wasn't jacked. He was very sweet.
I'm going to keep pitching it. But that's how inspiring is that to hear? Yeah, he's whatever age, and he put in place. And this is something that I've experienced and seen in other people. But I think it's like people hear that and think, oh, I'm just changing the way I breathe slightly, or I'm maybe just holding my nose, or I'm just trying to breathe kind of more lightly, more gently and slowing it down. How can that have an effect? I need a drug, I need something, I need an app or whatever. And it's like, no, this is very simple, but just watch the effect that it can have on you.
Yeah, the basics. And
yes.
This is one of the things which keeps coming up for chronic conditions with my kind of patients. And like when we are dealing with something chronic and complex, we can't forget the basics. Obviously, we may have to put extra drugs, or we might have to, but we can't do that at the cost of forgetting the basics. And lots of times we don't do the basics.
Yeah. Absolutely. Here to that. In so many aspects of life, the basics are the way to go. Oh man, it's been great. It's been great. I know this is, as we said, it was going to be quite a more bite-sized episode of the podcast because you've got to shoot off and get to a clinic, haven't you? No, sorry. Don't say sorry at all. No, I think it's been really valuable and condensed, and we've been quick, but we've covered a lot of bases. And I feel like this is what people want to hear. They want to hear what are some of these approaches that they can take that are very simple, changing slightly what you eat, having a look at the cleaning products at home and your habits there, and taking a look at the way you breathe as well, and trying some practices. I mean, there are apps out there, aren't there? There's YouTube videos that you can follow in terms of the Buteyko method or other ones to kind of get you started. And so it's just these simple basic solutions that could really make a difference. So it's invaluable. And I really appreciate your time coming on tonight.
No, thank you very much. I'm glad that it's valuable. And these simple things, when we are doing them over time, they start making us stronger and healthier. And we need less of the drugs. And that's the message.
Yeah, exactly. And surely we want to move down that road. Awesome. Right. Well, I do finish off with 3 quickfire questions. I guess I asked you them a couple of months ago, but maybe your answers have changed. And if you've got 2 minutes to do them, we can fire them out.
Let's try. I can't remember them now.
Oh, really? Well, if you want to say pass, that's absolutely fine. The first one is, what's one lesson you wish you'd have been taught? I do know your answer to this because I did a summary episode of this just yesterday, so I saw your answer to this. But if you want to answer it, or we can skip on to the next one. Did I finish the question? Did I say it? What's one lesson you wish?
Childhood.
Yeah, sorry, I didn't even finish the question. Man, I'm rushing and I need to slow down. What's one lesson you wish you'd have been taught as a child is the question.
Oh, there's so many. I think I remember now what I picked last time. It was about glasses, wasn't it?
Yes.
Yeah, yeah. Because I didn't have glasses till I was 8. I think I would say lots of things. And at this moment in time, the main thing which comes to me is, and I think I mentioned that I'm doing a clean coaching and extra training for my coaching. And just believing in that other person is resourceful, because I think now looking at that model of how it works, I knew where I wanted to go, even if nobody else thought that was possible. And now having that knowledge of okay, what I was doing was leading to all these things. This is like a dream, honestly. Where I am is like a dream for me. I didn't expect to be here. I just was working towards becoming a doctor and marrying my husband. But nobody at that point thought that I was going to be here doing all these things, or even being a doctor and wife to the best man in the world. Sorry, I don't know what I'm talking about. But just what I'm saying is that we all have a different way of doing things and different way of seeing things. And my way wasn't wrong. So many people tried to prove that it's not possible.
Yes.
And I wish I just knew. I don't know. Sam, you'll have to cut this off.
No, we're not cutting it off because it's beautiful. You lost your way a little bit, but it's all good stuff, Kiran. Don't worry. Okay. It's so good. And, I've seen your post on LinkedIn, the love you have for your husband, and also the inspiration you put out there in terms of from where you were to where you are now, and that belief that you've had in yourself despite, the naysayers, because we've all got them around us, haven't we, that are saying, no, that's not possible. You need to grow up. You need to be more realistic. That's not for you. And you are working at embodying and embodying the fact that it's possible. And to see your face light up and say that you're just so happy with where you are. I mean, who couldn't love to hear that?
Oh, thank you. But I don't know what I was trying to say there, but the main thing is that sometimes it's good to have the naysayers, because then it forces you to challenge yourself. Do I really, really want this? Or am I just saying it to say it? But sometimes the naysayers can become too powerful and they can actually bring us down. And what I'm trying to say exactly is that it's okay if somebody challenges you, but don't let anybody bring you down in what you believe in. Because the reason why you believe in something is because you can do it. You can be there. So keep believing that.
Love it. Love it. I think we should just leave it there. Just have that gold, that one question, and that's enough.
Okay.
However, where can people find you if they want to connect with you and find out more about your work?
Well, in my clinics.
LinkedIn? Yeah.
LinkedIn, yeah. Well, that's the best place at the moment on social media, because otherwise I'm just at home or in clinics.
Okay, perfect.
Yeah.
Perfect. Yeah. Thank you so much again. So glad that you decided to come back on the show, and appreciate your work and also the support and encouragement that you've given me for the past couple of months as well. Thank you.
No, I was happy to be here, and I'm hoping that people understand that basics work for airway health as well. And there's actually a leaflet, Sam, which I created,
yes.
and I can share the link, and people can look at it. I just remembered it was with another team, but it's a useful leaflet for people if they're looking for something which they can do themselves.
Yeah, great point. And I've got the link already because that was in my notes. Yeah. So I'll put that in the show notes so people.
And it's a peer-reviewed leaflet, so it's not just written by me; it's been peer-reviewed by other consultants and specialists. So it's kind of a fully evidence-based.
Perfect. Thanks for bringing that up. Right, thank you. I'll let you get on to your busy evening.
Yeah, thank you, and bye. Cheers. For now.
Yeah, see you later. Bye. Conversation with Dr. Kiran Agarwal. Enjoy. Thank you for tuning in. I really hope you found my conversation with Kiran insightful. If you did enjoy the episode, please share it with friends, family, and colleagues who you think find it helpful too. And you can support this podcast by following